Troubling end in such a sad story. You know, mental health is a topic that might be uncomfortable to talk about, but it's a conversation that is so important to have. Before the pandemic began, 1 in 10 adults reported symptoms of anxiety or depression. And then as of this past January, that number jumped to 4 in 10 adults. And keep in mind, that number represents only people who have reported symptoms. So we want to take a few minutes to go in depth tonight with an important conversation on this very difficult day. We're joined now by Jessica Piero, the Chief Executive Officer for Crisis Services. Jessica, thank you so much for joining us.
Thank you so much for having me and having this conversation.
We know May is Mental Health Awareness Month, Jessica, but mental health, of course, knows no boundaries. So let's talk first about the risk factors that increase the chance that a person might try to harm themselves.
Yeah, I think it is important to really understand what you might be witnessing with someone who might be at risk for a mental health crisis or suicidal crisis. And so we really want to encourage individuals who have either mental health existing conditions, who might have also prolonged stress, stressful life events. We also have to be very cautious of individuals that have had a previous attempt of suicide. Those are some immediate risk signs that we would definitely be paying attention to for somebody who might be need intervention or support.
We've got a list of risk factors on the screen right here. Depression, anxiety are just a few of them. And you touched on some of the signs that we need to be aware of. But can you go in depth a little bit more about some of the warning signs that a family member, a friend, perhaps a coworker can be looking out for? Because there's sometimes nuance, right?
Yeah, absolutely. And I think there's kind of 3 areas we look at. We look at how the person's talking, how they're behaving, and how their mood is. So when we talk in those kind of categories, warning signs to be looking for is how somebody is talking. So are they expressing thoughts of suicide straight out? Are they saying, I'm thinking of killing myself? Are they maybe expressing hopelessness or helplessness? Are they expressing feeling like they're a burden to their friends, family, or others? Those might be some warning signs to pay attention to and how they're talking. In regards to behavior, it's changes in behavior, including our basic needs, sleeping too much, sleeping too little, eating too much, eating too little, for example, starting to isolate more from family and friends, as well as increased use of substance abuse, alcohol, or other type of risky behaviors in that way. And then when we talk about mood, it's just the presentation. Are they more depressed? Are they more anxious? Are those things increasing maybe from what has been maybe a baseline for some people? When we start to see those things increase, those are definitely warning signs that we want to talk with somebody. I'm noticing this in you. Are you having thoughts of suicide? Can I help make a call with you to get help? And really help to be there with them to keep them safe, especially if these are heightened warning signs that you're witnessing.
Right, right. So you just touched on such an important thing is how to talk to people about potential issues, right? And we've made such strides in mental health awareness, but stigma is still a big factor here. So what would you say, Jessica, are some ways, some strategies that people can talk to somebody that they might be concerned about having those kinds of thoughts?
I think it really is as direct as saying, how are you doing? Are you okay? I'm noticing this in you. And I think that's really important is when we present back what we're observing, that we're noticing these behavior changes, we're noticing these comments, we're concerned about you. You know, we love you and we're concerned about you. What's going on? What can we do to help you? It might be as simple as those types of statements to start that conversation, to really understand where that person's at and what level of risk they might be at. Sometimes people just need to talk this through. Sometimes you might need to intervene and call an organization like Crisis Services to come out and actually do an intervention with somebody in crisis. So I think one of the important pieces too to really wrap this with is to know that for our community members, our family, friends, loved ones who are concerned about somebody else, you don't have to do that alone. If you need help or support on what to do or how to talk to your loved one, you can also use our 24-hour hotline for that support and consultation. And really know that you don't have to do this alone, that there are individuals like our crisis hotline counselors ready and available to you 24 hours a day to help through these crisis type types of situations.
Jessica Pirro from Crisis Services, thank you so much for your time tonight. And I'm going to bounce off of exactly what you were just talking about, because we need to be able to share with everybody that help is here. There is always someone to talk to. Here are the phone numbers that you can call, either number on your screen. Erie County Crisis Services at 834-3131 or Niagara County Crisis Services 285-3515. And we have more resources for you right now over at WKBW.com.